Hi guys, welcome back to our channel. It's just me by myself today. Michelle's working, but we just wanted to quickly make this video because in about 2 weeks, the FDA is going to decide whether or not they could issue the emergency use authorization to Pfizer and Moderna for their COVID vaccine. And if everything goes well, COVID-19 vaccine may be available by Christmas. So in this video, we'll be answering the 5 most common questions about the COVID-19 vaccine. Is it safe? Is it effective? Is it going to give me COVID? I know some of you guys are thinking that. When can I get it? And how long will the effects last? And at the end of the video, I'll also be sharing with you my personal concerns when it comes to the COVID-19 vaccine from the pharmacist perspective. This is going to be a very quick boom, boom, boom type of video, question, answer type of video. So please, please, please watch till the end of the video. It will mean so much to us. So without further delay, let's get right into it. Question number 1. Will this COVID vaccine give me COVID-19? There's definitely this fear, especially among people who believe that the flu shots give them the flu, but the answer is no. If you remember from our previous video on flu shots, we told you that unless the vaccine is made out of live virus, it cannot give you the actual infection. So the idea is the same. Both Moderna and Pfizer do not use live viruses. They're mRNA vaccines. So what is this mRNA vaccine? I found an article on National Institute of Health written by Dr. Francis Collins, and this is one of the very few articles I was able to explain it in the simplest way possible. So basically, the scientists were able to isolate a genetic sequence to a key protein called spike protein that's found on the surface of coronavirus. They used the sequence to make an instruction manual which is encoded in a genetic material called mRNA. Once this mRNA is administered as a vaccine, it instructs the immune cells in our body to replicate this spike protein as if they were exposed to the coronavirus. And as a result, our body learns and finds ways to protect us against this and makes antibodies. So by the time we're exposed to the real coronavirus with the same spike protein, our immune cells already know how to fight it. And this is how the mRNA vaccine trains our body for the real battle against the coronavirus. Pretty cool. Question number 2. When can I get this vaccine? As of December 1st, the CDC panel had voted that the higher risk group will be getting the first round of the vaccine. So we're talking about the frontline healthcare providers and residents living in long-term care facilities. For the general public, like us, it's probably not going to be till May or June of 2021. Question number 3. Will it be safe to get the vaccine? So as for the short-term side effects, both Moderna and Pfizer have announced that the side effects are very similar to mild COVID-like symptoms. So we're talking about, mild body aches, fever, chills, headaches, and things like that. And this does make sense because even flu shots, the side effects are mild flu-like symptoms. And as for the possibility of long-term side effects, no one knows for sure. We could only hope and pray that what the FDA commissioner had said is true when it comes to them approving the new vaccines. We're committed to expediting the development of COVID-19 vaccines, but not at the expense of sound science and decision making. We will not jeopardize the public's trust in our science-based independent review of these or any vaccines. There's too much at stake. Number 4. Is it effective? So according to the report, yes, they are effective. So for Pfizer, out of 170 people in the study who tested positive for COVID, only 8 of them had received the vaccine, and the rest of 162 patients or people received a placebo vaccine, which is a normal saline shot. That translates to about 95% effectiveness. And this same goes for Moderna. Out of 196 people in the study who tested positive for COVID, only 11 of them received the Moderna vaccination, and 185 received the placebo. And that translates to about 94% effectiveness. So both of these vaccines were over 90% effective, which is highly, highly impressive. Question number 5. How long does the protection last? Unfortunately, no one knows for sure yet, but we cannot eliminate the possibility of having to get booster shots or booster doses. But personally, if it means protection against this deadly virus, I really wouldn't mind having to get multiple doses of this vaccine. Okay, so all these updates are really exciting, and it's kind of a ray of hope for me that life can actually go back to normal. But as a pharmacist, I do have some concerns. Both Pfizer and Moderna vaccines need to be administered in 2 doses, about 3 to 4 weeks apart. And this is what concerns me a little bit. And that's because of what I saw with another vaccine that also needs 2 doses. It was a shingle shot, and from what I saw back then is that a lot of people didn't come back for the second dose of the vaccine, which makes it not as effective. And that happened because either they forgot or the side effects from the first dose was a little too much that it discouraged them from getting the second dose. And honestly, who's to say that this won't happen with the COVID-19 vaccine? And a bigger issue that I saw with the shingle shot was at a national level with the national back order. So there was enough to go around for the first dose. But when it came time for the second doses, the company just couldn't keep up with the demand. So every pharmacy had pages and pages of people on the waiting list to get their second dose. And honestly, unfortunately, a lot of people miss the time window of getting the second dose. And I honestly hope that this won't happen with the COVID-19 vaccine. But I know that there are so many people working so diligently to make sure that there's enough for everyone. So my fingers are crossed. And the next concern I have is the storing and the handling of the vaccine. So you probably heard that Pfizer's vaccine needs to be stored at minus 94 degrees Fahrenheit. That's really cold. Like, it's colder than ice. It's colder than a regular freezer. But, Pfizer said they'll ship it out in a special container, and you could store the vaccine in there for up to 15 days, given that you only open it 2 times a day max, and for no more than 1 minute at a time. And under normal refrigeration, the vaccine is only safe for up to 5 days. And this very tight restriction on storage, I feel like is a little impractical in a retail setting. But of course, there is an option to purchase a ultra low temperature, ultra cold freezer that could go all the way down to 120 degrees Fahrenheit, but each of them costs about $20,000. So I don't know if most pharmacies will be able to afford that. But the good news is that Moderna's vaccine has a much more lenient storage requirement. They are good under minus 4 degrees Fahrenheit for longer stability or shelf life, and can be stored in a regular fridge for up to 30 days. So why am I still concerned? Since storage is more convenient, I could already see tens of thousands of pharmacies trying to order from Moderna. And hopefully, Moderna will be able to, keep up with the demand and supply as many as they can. And that's it for today. It felt so weird not having Michelle with me, and I know you guys miss Michelle, but I hope that this video was able to answer some of the questions you had about the COVID-19 vaccine. And of course, as we get more updates, we'll definitely keep you posted, so stay tuned and stay safe. See you in our next video. Bye!